One of the things that the center is increasingly becoming interested in are alternative treatments for chronic pain. And the reason that we are so interested in this idea of alternative treatments, and by that I primarily mean treatments that are not drugs, is that the drugs we have right now do not work particularly well for large numbers of chronic pain patients. So some of the best drugs that we have maybe help 1 out of 3 patients who take them. And what that means is that the clinician is left doing a lot of trial and error. And in addition to that, there are a lot of patients who don't like to take drugs and who don't like the side effects. And so what we need now are to develop ways of helping people with chronic pain that are not primarily pharmacological.
There's a number of behavioral lifestyle skills that can be included in chronic pain management. For many years, we've known that there are non-pharmacological and self-management approaches that can be effective. However, these are not routinely included in clinical practice. These would include things such as exercise, diet would be included in that, cognitive behavioral therapy, behavioral sleep strategies, sometimes pacing strategies. And the patient needs to engage in a relationship with their provider or their provider team and make that plan together. We have a lot of evidence that this approach can work for folks.
We as psychologists have spent most of our time looking at what's wrong with people, looking at negative emotions, and there's been a lot of work looking at depression and anxiety and its relationship with pain, and that's a really powerful relationship. But there's also another side of the coin, that we as human beings also have positive emotions, and terms like resilience have become really captivating. You know, what is it about patients that might make them resilient, and what role could positive affect play in pain? And so based on the field of positive psychology, we have developed a series of interventions to help patients in chronic pain settings do better. So what we instruct patients to do is to reflect on the things that happened that day and think about something that made them particularly happy, and then write it down on a piece of paper and then put it in the piggy bank. And we instruct them to do this every single day. In one of the studies where we used the positive piggy bank, we had women with breast cancer 2 to 3 weeks before surgery begin to write these positive memory slips. And then on the night of their surgery, we called them and said, read all these happy memory slips. And what we found in this very, very small study was preliminary evidence that just doing this simple positive piggy bank intervention greatly decreased their levels of anxiety pre-surgically. And we know that pre-surgical anxiety predicts just about everything we don't want to see in patients, especially post-operative pain.
There's a lot of fatigue in cancer survivors, even many years after the end of their treatments, and there aren't really many good treatments for that. And so we decided to look at self-acupressure, where instead of putting needles at these individual points in the body to treat illnesses and promote health, you use your finger or your thumb or a device to put pressure on those points. For about 2/3 of people who do self-acupressure, it works. Cancer survivors can learn this very easily. They can be kind of taught in about 15 minutes, and it's incredibly safe. The acupressure treatment also decreased the pain.
We've been asking this question, does calorie restriction do something for pain? And does it do something for these other symptoms that we're so interested in as a center? And so one of the more exciting things that we've been doing recently is a collaboration with someone in internal medicine who's conducting a weight loss intervention. And so we embedded some measures of pain into this study, and what we found was really quite remarkable. A patient who's very obese who engages in this calorie restriction experiences not only improvement in pain in those parts of the body that we already knew were affected by obesity, like the knees and the hips, but they also experience an improvement in pain spread throughout the rest of the body. So less headache, less gastrointestinal symptoms, less pain in the back. Their fatigue got better, their difficulties with sleep got better, their difficulties with concentrating and paying attention got better. And so it appears that calorie restriction for at least some people has a remarkable impact on symptoms of what we call centralized pain.
My hope is that if providers and patients together start to collectively shift their attention from looking for quick fixes for pain, like procedures and medications, that really we're going to get a system-level shift towards support for all of the lifestyle change, behavior change, things that a patient needs to do to really make their pain improve.